Craniosacral therapy is a very gentle but powerful technique that is well suited to lots of complex pain and dysfunction, facial trauma, musculoskeletal trauma, injuries involving the spine, brain, and spinal cord. We don't treat the brain per se, but we treat the environment of the brain and spinal cord, which makes it very powerful. It's a complex system, but it's simple in some ways. It can start with you as a beginner. Your patients will benefit greatly from it right from the very beginning, and then you can grow with it as your skills improve. I've been teaching and studying craniosacral therapy for over 30 years, and I'm still learning new things today, which is what I love about it. It's transformed the way I think, and it's a very powerful technique for physical therapists, occupational therapists, therapists really of all kinds. Anybody who does manual therapy is a very good candidate to perform this kind of work and to help patients that they could not help before. So I'm Steve. I'm a physical therapist. I've been a therapist for over 40 years, and I've been teaching and studying craniosacral therapy for close to 35 years. I've written 45 to 70 articles on craniosacral therapy and myofascial release. They've been published in dental magazines, physical therapy magazines, professional journals, and magazines for the layperson as well. And I've been studying with both the Upledger Institute and John Barnes PT for many years. I was a teaching instructor with John for the 90s, throughout most of the 90s into the early 2000s. And I really am looking forward to bringing this class to you in a new and exciting way.